Hi everyone, my name is Kristen Nichols, and for today's topic, I am going to be covering hepatitis C. So I did a backwards design plan, and for hepatitis C, my desired results are students in the baccalaureate nursing program will understand disease processes of the main systems of the human body and be familiar with the pharmacologic treatment associated with diseases. So for this lesson plan, students will demonstrate understanding of the hepatitis C virus and what treatment is available for these individuals. Nursing students will understand the pathophysiology of hepatitis C, will understand some of the medications used to treat hepatitis C, and will understand follow-up testing required once pharmacologic treatment for hepatitis C has been started. For the student objectives, students will be able to understand the disease process of hepatitis C, identify those at risk for hepatitis C, identify pharmacologic treatment for the virus, identify lab studies and how they correlate to the virus, and also be able to provide patient education and deliver safe patient care to those diagnosed with hepatitis C. So for my assessment evidence, I am going to be using a PowerPoint lecture that will cover hepatitis C virus and the pharmacologic treatment. In addition, I will be showing a short video at the beginning that will kind of just have a very brief intro to what the hepatitis C virus is and how it affects the body. And then after the PowerPoint lecture, students will break up into groups and do a group case study followed by a class discussion to promote critical thinking. And then at the end, there will be a 5-question multiple choice quiz. So like I said, my resources are going to be my PowerPoint lecture, a YouTube video covering what hepatitis C virus is, the case study, and the quiz. To begin, I'm going to introduce the students to the hepatitis C virus, and a few facts will be given along with the YouTube video that is a short 2-minute video that will allow them to have a better understanding of the topic that will be discussed. Students will be expected to participate and engage with the professor and peers during the PowerPoint lecture and group case study. In addition, students will be expected to complete a quiz at the end of the class to show understanding of the topic discussed. So I'm going to, excuse me one second, I gotta bring out my other PowerPoint. I am going to just go over the case study that I would set up for the baccalaureate nursing students. The learning objectives for this lesson is to understand the pathophysiology of hepatitis C, identify those at risk, be familiar with some of the medications to manage hepatitis C, and to describe follow-up testing once pharmacologic treatment for hepatitis has been started. So hepatitis C is a common blood-borne pathogen. It is usually acquired through IV drug use. However, it can also be acquired through sexual contact, hemodialysis, or blood transfusions if they were before 1992. Individuals are often undiagnosed with hepatitis C just because there aren't really any symptoms that pop up, not until it becomes more chronic. So a third of adults may experience some fatigue, nausea, or white upper quadrant pain, but for the most part, they don't experience any symptoms. Cirrhosis can occur due to prolonged hepatitis. So diagnosis of hepatitis C is confirmed through a blood test called the reactive enzyme immunoassay anti-HCV test. There are 6 genotypes of the hepatitis C virus, and the most common genotype is genotype 1. So the treatment for hepatitis C is dependent upon what genotype you are. But the most common, of course, is one. So the goal of treatment in individuals with hepatitis C is to reduce hepatic-associated complications and overall mortality. So there are two pharmacologic therapies that I'm going to be covering in this PowerPoint. The first one is pegylated interferon. Interferon-based treatments work by stopping the viral replication in the body and proliferation through immunomodulation. This one has adverse reactions such as flu-like symptoms, hematologic events, or neuropsychiatric events. The other medication is called the Vicura pack. This is a combination of 3 medications. They are antiviral medications that works by stopping the viral spread inside the body. This one has very few side effects, and it can actually treat a lot of like I said earlier, there are 6 genotypes. It can treat a wide variety of genotypes and is safe for patients with other comorbidities. Individuals taking any antiviral regimen need to make sure they are getting plenty of rest, drinking plenty of fluid, and taking moderate doses of acetaminophen if needed. Sustained virological response, SVR, represents eradication of the virus from the body. So this is usually tested 24 to 48 weeks after treatment with the antivirals. And if that comes back negative, it shows that the virus is out of the body. So for my case study, I have a 28-year-old male that presents to the emergency room with fatigue, nausea, vomiting, and right upper quadrant pain for the past 5 days. Upon first look, the nurse notices track marks on the patient's bilateral upper extremities. The patient admits that he has a problem with IV drug use. The fatigue and nausea vomiting has been off and on for the past 8 months. However, he is just now seeking treatment due to the pain in his right upper quadrant. For the students will be obtaining, this is when they will be breaking into groups of 3 or 4. They will all have the same case study, and they will work together in groups for about 20 minutes. And then once they have worked together, we will come back together as a class and kind of go over the case study and review what each group kind of found. So students are going to obtain a medical history and examine the patient. The patient has no known drug allergies, has past medical history of IV drug abuse, no past surgical history. He is currently not taking any medications, and family history includes a mother with a history of schizophrenia and a father with a history of drug abuse and depression. So the patient has stated that he is homeless and has been living on the streets for the past several months. He has been to drug rehab in the past and has always relapsed. He is still using IV drugs and admits that he is unsure if the needles are always clean. Vital signs include temperature of 98.7, heart rate of 110, blood pressure 108/72, respirations of 18. The nurse notices skin track marks on bilateral upper extremities, tenderness to his right upper quadrant of his abdomen upon touch and palpation. His labs, we drew liver enzymes. His AST and ALT are both elevated. He had a positive anti-HCV test, which is the one that will tell you if you test positive for hepatitis C. Urine drug screen came back positive for cocaine and methamphetamines, and he is genotype 1. So the questions for this case study are who are at risk for contacting, or questions for the students to think about, are who are at risk for contacting the hepatitis C virus, what lab test determines diagnosis of the hepatitis C virus, what medications are used, what is the goal of treatment, and what follow-up care will individuals need. So, in conclusion, with this is regards to the case study, with the patient's current use of IV drug use and him living on the streets, the chance of him using a dirty needle is likely. The hepatitis C virus is a bloodborne pathogen and most often acquired through IV drug use. The patient's symptoms have been ongoing for the past 8 months, however, he is just seeking treatment. Those with acute HCV are often asymptomatic. However, once the virus has been in the body for longer than 6 months, that is when you can start to see symptoms. So diagnosis of HCV is confirmed with reactive enzyme immunoassay for anti-HCV. And that concludes my presentation. And then, of course, attached will be the 5-question multiple choice quiz. And then at the end of the class, we'll all come together to answer any questions or to clarify anything about the hepatitis C virus. Thank you.